All right, we are back. I hope everybody is enjoying the program. A couple of great presentations to start us out there, and we have another one coming up here, our third and final presentation. Another friend of WPA's, Emily Devine, is a physical therapist at Stoughton Health. She's certified as a LSVT BIG clinician as well as a power clinician. In addition to working with support groups in the area on how physical therapy and exercise can impact Parkinson's disease, Emily started a local exercise class for people with Parkinson's in Stoughton. We're proud to say that this class was a recipient of a grant from WPA in 2019. They're doing great work out there. Welcome, Emily.
Good morning, everybody. Thanks, Gary. As Gary said, my name is Emily Devine. I'm a physical therapist at Stoughton Health, which is in Stoughton, Wisconsin, which is right outside of Madison, for those of you that have never heard of that town. I've been practicing at Stoughton Health for about 12 years in outpatient orthopedics and sports medicine, and I've kind of had, I guess, like a side gig of working with the community of folks that have Parkinson's disease. And I started a community exercise class a few years back, and that gave me an amazing opportunity to cross paths with a lot of hardworking individuals that are trying to manage their Parkinson's every day. I want to thank the Wisconsin Parkinson's Association specifically here today, because you guys have been true trailblazers in virtual education and virtual programs, and that's really helping all of you stay engaged and stay healthy during the pandemic. So thank you for that. So we'll get to some slides here. So let's talk a little bit about falls and exercise. Let's chat a little bit about falls officially. Okay, so I can't see everybody that I know is out there listening, but I want everyone to just take a little bit of a time and think honestly to yourself, have you had a fall or even a near fall in the last 6 months? So just kind of think about that. And I would expect that most of you maybe are kind of raising your hand or shaking your head. That's a pretty common fear and occurrence with people with Parkinson's disease. Now, I'm going to tell you the therapist definition of a fall, and I'm curious to see if this will change some people's answers to that question. So a fall is defined by an event that kind of leads to an unplanned or an unexpected contact with a supporting surface. Now, the supporting surface, yes, can be the floor, but it also could be like a piece of furniture or even a wall. So, and that result of that contact is not because of a push or a shove or a medical event like you fainted or you had a stroke or something. So now I wonder, after you know that definition of what a fall is, if that changed any of your answers. And I would suspect that for some, now you're maybe nodding your head, okay, maybe I have had what's considered a fall in the last 6 months. Now, the interesting thing is that 1 out of 4 people fall every year. And this is just general. This is not just with folks with Parkinson's disease, but less than half of the people that do have a fall do not tell their physician. And falling once can double your chance of falling again. And in fact, fear of falling is one of the highest predictors of having a fall. 95% of hip fractures occur from a fall, and every hour, 183 ER visits are due to a fall. Now, falls and the reasons for falls are actually really complex. And obviously, it can be your age. It can be maybe you have some weakness or some vision issues. Medication is a big thing. If you take more than 4 medications, which a lot of people do, that can increase your risk. It can be how you're using or not using maybe your assistive device. Home hazards can be an issue or a factor, low blood pressure, again, history of falls, and then various medical conditions, and that's where Parkinson's kind of comes into play. Now, there are things that you can do to stay safe at home, and again, just generally speaking, this is for everybody, regardless if you have Parkinson's disease or not, but making sure you have adequate lighting is a really big part of it. So, doing night lights at night in hallways, leaving on the kitchen light or something so you have some light that you can use in the nighttime. Using grab bars next to a toilet or shower or even a bed railing. And those are so accessible and easy to get just at your local hardware stores, you know, Menards, Home Depot, Lowe's, places like that. Removing rugs, securing down carpet if it tends to kind of come up in some places, because that can be a trip hazard. Obviously, using your assistive device if you were advised to use one. And U-steps are a common device used for folks with Parkinson's. If you've never seen one of those, they're kind of a cool piece of equipment. They literally look like a U. The difference with a U-step versus a classic walker is you actually have to squeeze the brakes to make it go, and letting go of that handle makes it stop. So that's why it's a little bit safer with Parkinson's. And then, of course, organizing a clear walking path room to room can help make you stay safe at home as well. Now, the other kind of thing this might be a nice thing to do, since a lot of us are looking for things to stay busy around our houses right now, but organizing items in cabinets. And so what I mean by that, if you have a lot of items that are high up in your cabinets that you use a lot, so you're constantly having to reach high up overhead, or maybe even standing on a stool or something to get those items a lot, this is the time to take a lot of those things down from higher up and bring them down to a lower level in your cabinets or in your kitchen, to make it so you don't have to use those step stools or reach really high to make yourself more at risk for falling. Another great little trick is taping electrical cords, so like from lamps and such, to the outlets, taping those back along the wall so they don't become trip hazards or get misplaced where you're not sure they're there and you trip over them. In the kitchen or even in the bathtub can help you feel more safe when you're in your bare feet and getting some traction in there. And then one of my favorite tricks, and this is probably good for anybody, but really for Parkinson's too, and we'll talk more about this, is on the stairs. If you do have steps like to the basement, to your washer or something like that, using like a really light colored tape, something like this would be great, or like an electrical tape, and just taping the very tip or edge of your step so it's brighter, so you can see where that edge of the step is going into the next stair. And you can do that same thing on thresholds. And by thresholds, I mean like maybe where you come into your mudroom of your home, or where your garage goes into your kitchen and there's just a little bit of a lip. Right there, put a piece of tape so you can see that edge, and it cues you to see it a little bit better. Now, wearing glasses, if you if you're supposed to wear glasses, obviously that's kind of a no-brainer, but you'd be surprised. Sometimes I don't wear mine. And making sure you get your eyes checked regularly is also really important every year. Now, pets and small children, they're awfully cute and cuddly, but sometimes if they get wrapped around our legs or are someplace where we're not expecting them, they can also be a hazard for falling. So just make sure you're very aware of what's around you. When you get out of bed, off the toilet, out of chairs, you also want to do that nice and slow. And what that will allow you to do is just adjust to that transition to try to not get dizzy, where you could potentially lose your balance. Cell phones are pretty handy these days. Most people do have them. So if you do happen to have one, keep it handy on you. And whether it's in your pocket or your shirt pocket, or if you use a walker, having a little case for it on your walker, just keeping it handy. So if you do happen to have a fall, you're able to access that really quickly to call for help should you need it. And always remember to pace yourself. Try not to get in too much of a hurry, because that can sometimes be where things go wrong. I would also advise you, if you are one of those people that uses more than 4 medications every day, then maybe your next visit with your primary care provider, you take an opportunity to review your medications with them and just talk to them about your medication use. Now, some of those tips, again, like we just talked about, are very valid for people with Parkinson's and without Parkinson's. Now let's talk a little bit more specifics, though, about some things that you can do if you do have Parkinson's, and some things to try to remember to keep you safer. Specifically, you want to try to always keep at least one hand free at all times. Using a little backpack helps. You can use a little fanny pack. I have one. I brought it here just to show you what that was. That's a great way to carry items, even if it's something small, to get to where you need to go. And you want to try to never carry items in both hands at the same time when you're walking. Again, trying to have one arm or one hand free. Attempt to swing both your arms from front to back while you walk. So if you do enjoy going out for walks and you struggle with this a little bit, walking sticks are a great investment because they can help cue your arm movement. And the arm movement is important because it causes like reciprocal motion to your leg, which helps you stay balanced and stay upright. You want to consciously lift your feet when you're taking steps. And if I know I have some of my community class participants and listening in today, and they've constantly heard this from me, think big. And that means with your steps, pick your feet up and take a nice big step when you're walking. When you are trying to navigate turns, try to do more of a U-shaped turn versus that quick pivot. Sometimes when we try to do a quick pivot, our feet kind of cross over each other, and then that causes a trip hazard where we're literally tripping over our own feet. So taking a nice wide turn, or that's something also if you still struggle with that you can work with in physical therapy with one of your PTs. And we'll talk a little bit about more turning techniques in a bit. Now with Parkinson's, we do tend to have a more narrow base of support, meaning our feet tend to kind of be very close together, and that can make balance a little more challenging. So always try to have your feet about shoulder width apart, just to give you a nice steady stance. And again, try to do one thing at a time, pace yourself. Now, with my profession and when I work with people with Parkinson, they get a lot of questions often about freezing and what to do if you become frozen. And unfortunately, freezing can happen in a lot of different scenarios, sit to stand, turning, going to walk, things like that. My first bit of advice would be to take a nice deep breath. Freezing can increase with anxiety. So if you start to get anxious because you're frozen, that's just going to almost make it worse. So just trying to take a moment, take a nice deep breath just to kind of bring those nerves down a little bit. Now this is where you can use some really cool specific techniques that work great. So I encourage you to try them if you are having trouble with freezing. You can visualize stepping over like an imaginary object on the floor should you be getting frozen and standing. Or if you're with a caregiver or a partner, you can ask them to put their foot literally right in front of yours, and that's your cue, and you step right over that foot. Now, the other thing is if you're kind of walking and you're getting froze where you're starting to kind of festinate or go forward, take a deep breath, stop, rock side to side, and then step or start that action again. That's a great skill too if you get frozen when you're trying to like perform a sit to stand off the chair or off the toilet. Try rocking a little bit side to side. That's been shown to break kind of that freeze a little bit and see if that works for you. The one thing not to do in this scenario is try not to have a caregiver or a companion try to pull you through that freeze. Sometimes that can throw you off balance a lot more, even prolong the episode of freezing. So try some of those other techniques first. For those of you that do have cell phones, you have apps nowadays, which is kind of neat. And you can use a metronome app, which is just where you can adjust the beat and listen to a beat. And that's a great tool. Along with a good beat of a music of some song to use for trying to do different movements or even walk. So if you do have a cell phone, I'd say today try to find a metronome app and play around with that a little bit and see how that impacts your walking. I think you'll find it's quite surprising of how much better it makes you walk and take big steps. So there are different cues that we use in physical therapy that you can easily learn and use on your own to help you move a little bit better to avoid falls. The first type of cue is called an auditory cue. And this is probably with research that's been shown to be one of the more effective of the cues. And so an example of this would be that metronome app, for example. When you hear a beat, you know that that beat means that's every step you should take, for example. Or you can use a certain word. In this case, an example I gave you on your slide is the word go. And so when you like say go, or maybe your companion says go, that means you're starting to walk or that's when you go to step up onto a step, or that's when you go to get out of your chair. The key, though, with the auditory cues and the success of them is that your auditory cue has to match the function of what you're trying to do. So you can't say 1, 2, 3, and then just try to go and get up. 1 would actually be the motion of getting up, or 2 would be the motion of taking that first step to walk. So those cues have to match the action you're trying to do. You can also use visual cues. This one is a really good cue, I think. For example, I've had patients that have, for example, been like at the kitchen doing dishes or something, or cooking, and they want to go and turn to their right, maybe to get something out of their fridge, and they get a little stuck there, or they get froze. So this would be a time where maybe you look at your floor and say, hey, I have wood planks, or I have like a pattern on my floor in my kitchen, or maybe there's squares or blocks. And you can look at that block and say, okay, when I'm trying to turn, I'm going to step to that next square or that next pattern. And that's a visual cue that's telling you, I'm going to take a step that way. And that will help you with your turning and get that a lot more fluid. The last kind of cue that you can use is visualization. This one can be a little harder for some people. But this one is a really nice one when you're kind of in an environment that you're not familiar with, meaning you're outside of your home and you're having some symptoms with freezing or just trouble moving. An example would be, let's say you are maybe even going into a doctor's appointment and there's a doorway. A doorway is a common area where people can get frozen or get a little stuck or start festinating with their steps. So instead of focusing on the doorway, what I'd ask you to try to do is visualize or look beyond the doorway. If there's a window you can see through the door, look beyond that through the window and see what's beyond that and walk to that, not just to the doorway. So you're visualizing something beyond where that door is. The other thing you can do is visualize a clock on the floor, and this is really good success with when they're trying to turn. This is probably where this is most efficient. So for example, if you're standing up, 12 o'clock would be in front of me, 3 o'clock would be to my right, 6 o'clock would be behind me, and 9 o'clock is this way. So if I'm trying to turn to my right, I would visualize the clock. I'm at 12, I need to move the hand of my clock, which would be my feet, to 3. And there's my big turn. So visualizing that clock on the ground is a great, quick and easy thing you can use any environment that you're in where you seem to have some symptoms or a little bit of difficulty stepping or turning. The other example I put is puppet on a string. This works for some people. And this is the one where it would potentially work with more arm swing or moving your arms with walking. And it would be visualizing that you're a puppet on the string. So think about old school puppets where our hands and our legs are all kind of attached to strings, and our right arm is attached to my left knee, and as I move, they move together to get those reciprocal motions. So try some of these techniques out. I will tell you, every technique doesn't work for everyone. So if you try an auditory cue and you just aren't getting anything from it, don't just quit on them. Try one of those different cues. Cues work differently for different people. And over time, if you keep using the word go for an auditory cue, guess what? Over time, your body's going to get used to that. It's not going to be a new thing that you have to pay attention to anymore. You might have to change your cue or even change your word. So just keep an open mind, but give them a try. I think you guys will be really, really surprised with how quickly you can see cool outcomes from what you're trying to do. Okay, so a few things I wanted to talk about, especially because a lot of you guys have been at home, and I want to make sure you are using assistive devices appropriately and that they're fit for you. So I'm going to show you how to do that quick here. The first one I wanted to talk about is just a cane. Now, the first thing with cane use is you want to make sure that it's the correct height. And obviously, yeah, when we're home, we don't maybe want to go and access services to have somebody show us how to do that. So I'm going to show you right now. So I have a cane with me. It's just a basic aluminum cane, okay? Now, when you have a cane, when you stand, The part of your wrist right here should be in line with the handle. When you stand, that's where that handle should fall, okay? So standing up, you can see when my hand is down to my side, the break of my wrist is right at the handle, okay? Should that not be the case when you're checking your own cane at home, you need to adjust it. And how you do that in an aluminum cane, you would unscrew the end here. There's usually a little knob. You would just push that in and adjust the height of the cane appropriately to fit for you. And then, of course, tighten that back up. That's going to make a big difference with your comfort with walking. And the other thing with that is, because it's a cane, we generally want to use the cane on the opposite side of where you're having more issues. So let's say maybe you have more problems moving your left leg, or maybe you even have left knee pain or something. You'd want to use the cane on the right side because it follows the weaker leg. Sometimes people use it on the same side, and that's incorrect. So you'll get the most benefit if it's the right height and you use it on the other side. You want to make sure too that the tip of your cane here is nice and clean and free of debris. And then when you are using your cane, if you're walking up a slope or an incline, or unfortunately maybe on some slippery surfaces, if ice does occur and you're stuck in that, you want to have a nice wide stance with that cane. They say walk like a penguin, and that's pretty true. Nice wide stance. Some similarities are seen with walker fits. So the next slide is just kind of some of the same cues. With regards to a walker fit, I don't have that in here with me today, but it's the same idea. When you're standing in your walker, relax your arms to your side and make sure that part of your wrist is right in line with where you would hold on to the walker. If it's not, make adjustments on all four legs so that can happen. The big thing with the walker that people need to be careful of and to be safer is to make sure that when you do get up from a chair or the edge of the bed, that you aren't pulling up on that walker. You really want to try to push up from the bed or the chair's handles and then grab your walker, because the walker isn't a stable surface. It can move on you, and that can be problematic and result in a fall. And the other thing is make sure that walker doesn't lead you, that you lead the walker. Sometimes those walkers can get away from people, and that makes it really challenging. And again, if it gets too far away from you, you can really lose your balance falling forward in that case. Same thing with the cane. Make sure that you check the tips. It's not so bad right now because it's summertime, but during the winter, just with gravel and salt and things like that, those tips can get really yucky. And so just kind of keep your eye on them and check them out to make sure they're not plugged up with stuff. And if they are, you might need to get new tips or just clean them out. Okay. Now, let's talk about exercise. We just talked about falls and some things that you can try to help reduce falls. But what we know from a lot of research is that exercise and being strong can actually help prevent a lot of that stuff too. In fact, they found that people with Parkinson's who exercise 2.5 hours per week. Now, that's not much, you guys. That's like 30 minutes 5 times a week. You can do that, I think, especially when we're stuck at home. So what better time to start a new habit? But they have found that lower degrees of mobility impairment occur with those people. There's less caregiver burden, which I know is important to a lot of us. And there's less impairment just with your everyday activities. So it's really beneficial to get out there and get moving. I get this question a lot in PT, and it's kind of like, well, I was just diagnosed. When do I have to start all this stuff? Now, you got to start now. The sooner you start, the better. The earlier you start, the better. You can slow your decline in quality of life. So now, no time better than now. There has even been some studies that show that just a treadmill training, like walking on a treadmill one time, can improve people's walking. I wouldn't suggest you do that if you've never been on a treadmill before. Maybe do that with a clinician, but it can really help just practicing that. There's also a program called LSVT Big. I think Gary mentioned that I was certified in that. And we'll talk about that a little bit more detail in the next slide, but it's a great program to participate in with a local clinician that's certified that people see awesome results with. So I'd encourage you to check that out too. And there's a ton of group exercise classes. Unfortunately, I know They're all kind of on hold right now, but like I said, the WPA is doing awesome, trailblazing the way to get some virtual classes available to you, and those are hugely beneficial. And the reason is because not only do they motivate you to show up because you know people are waiting for you, but you get to watch other people move, and they're modeling the behaviors and the movement that you need to use, and that helps. That kind of helps our brain in a different way. So those are great classes to try to participate in, even virtually. And they all are shown to reduce falls. So what better reason than that? So let's talk a little bit, though, about LSVT. So LSVT stands for Lee Silverman Voice Treatment. It's based off a Loud. It's called LSVT Loud. That's what started this whole thing. I'm sure there's a lot of you out there that have either tried either Loud or Big or both, which is great. The idea of these programs and on Big is it focuses on what's called high amplitude movements. And what that means is your bigness of movement. So amplitude means, okay, if I'm going to say raise your arm, so go ahead and try this, everyone, just raise your arm. And if you're here, I know you can do bigger. So bigger, raise your arm, bigger. So what we're trying to do is get you to move through your full ability, your full amplitude of what you can do. And unfortunately with Parkinson's, this feels normal. So we don't know that we're not moving big enough. My phrase I tell a lot of my patients, that if it doesn't feel weird, it's probably not big enough, because this is going to feel weird, but this is also big. So think about some of those movements when you're working out. Now these classes are really focused with LSVT Big on like multiple repetitions. It's over and over and over and over, and higher intensity. So if 10 is like the highest you can ever work, you need to work at about a 6 or 7, and that's going to give you the best benefit. And the other thing is, over that program, things get harder and harder, and continually more complex as you get better and better. Now, these treatments are 4 times a week, 1-hour sessions for a total of a month, essentially, or 4 weeks. So they're pretty intense. It's a big time commitment. So you want to look at your schedules if you're interested in doing something like that, because you do need to have that 1-month commitment. I will say almost every patient I've had go through that program, they are all surprised it's over when it's over, because it goes so quick. It's fun. But again, the goal, like I wrote on your slide, is to really improve your movement perception, kind of recalibrate yourself, learn what a new big is, learn that this isn't big enough, this is big enough. Our hospital has 2 clinicians at both our Stoughton hospital and our Oregon clinics that are certified with Big, and we have 1 clinician that's certified in Loud. I'm sure if you don't live around the Madison area, there are other clinicians in your area that probably have this certification, but this program is great, and it's never too early to start. So if you're newly diagnosed, get on it now, because I bet they'll find some things you need to work on. I love that program. You can probably tell, right? Okay, now exercises. So exercise regularly, and then I put in your slide is it's kind of a forever thing. You don't get to stop. Once you get started, it's a forever thing. It's something that you're going to have to keep doing. So try to find some joy in it. And what I mean by that, you want to find something that's sustainable, that's something you know you can keep doing, and you want to find something that's simple and affordable. Again, so you can keep doing it. We really want to focus on a higher intensity when we exercise, meaning you want to feel like you're doing a little bit of work. And big focus, of course, is on our posture to kind of think big or get big, but also on lower body strengthening, like our ankles and our core and our knee. There are some good classes out there or even videos for dynamic balance, and those would be things like with Tai Chi. So I know there's a lot of people that do take those classes, and they're excellent as well. So that being said, let's exercise. So I know everyone's probably sitting in front of their computer right now. So this is a great opportunity for you maybe to get up if you can, or kind of relocate where you have a little space. What I thought I would do, since everyone is stuck at home, I would give you some exercises that you could try to start on your own today. And that's how we're going to finish our session today before we talk about any questions people have. We're going to go through the exercises. I'll try to demo them a little bit as well. I think the pictures that you have are going to be pretty good. And I know these are going to be available for you in the future. So if you can't take down notes, don't worry, you'll have access to these down the road. But let's go ahead and try some of these exercises together that will really focus on some of those things I was just talking about. Again, I think they're fairly simple. They're also easy to progress or make a little bit harder. So let's see how you do. Okay, so the first one, I guess. The first one is kind of a basic one in a sense that it's a sit to stand. This is a technique and a function that a lot of people struggle with. But this would be a great way of you to try some of those things we talked about earlier with either an auditory cue, meaning when I stand, I'm going to say go, and go means the action. So go, and I stand on up. So you can try that at home. So a sit to stand. I put to try to do 10 reps. If you can't do 10, start where you can and get a goal of 10 and work up to that. Now, if you can't do it without holding on, that's fine too. Find a chair that has armrests. And how you would progress yourself is maybe you start with your armrests. You use them to stand up the first few times. And over time, maybe you take one of your hands away and only use one of your armrests. And then over time, you try it with nothing. So you can slowly progress that. If you have no trouble standing up with just the basic chair and no hands, add some weights to your hands and make it a little bit harder. Okay, so that's kind of a great functional exercise, a good bang for your buck exercise. We all want to try to be able to stand up tall. The other one is sidestepping. So what you'll do with that, just like the picture, go at your counter. Great place to do this is be right in your kitchen or maybe around your table. And you're literally going to stand and step sideways. Here I go, off the screen. And then right back. Okay, that's going to help with your working on nice big steps, picking those feet up to take those nice big steps, but it's also going to work the outer side of your hips. Okay, all right, let's move to the next slide. Okay, so we have two words here, tandem. We have a tandem walk and a tandem stand. Tandem walk is essentially walking like you're walking on a tightrope, heel to toe and heel to toe. Again, you're going to want to do this right at the counter or around your kitchen table where you have a hand available. And then to make that a little bit harder over time, maybe you just have 2 fingers on the table. And as that gets easier, maybe 1 finger. And as that gets easier, you try no hands with just your hand nearby. So it's a way you can continue to practice moving forward. The last one on the screen here is tandem stance. And that means you're literally having 1 foot in front of the other and you're just standing still. Again, you want to be at a countertop or somewhere where you can hold. You could probably do this on the back of a chair as long as you're not holding on too much to it and it makes it unstable. This one you want to be equally balanced on the front and the back foot, so you're working each leg equally. See if you can stand there, maybe 2 hands you start, and then over time you go down to 1, maybe then 2 fingers, maybe you hover, and then you switch your feet and you try it the other way as well. So this is a great one to help your balance. I know when I teach my community exercise classes and we spend time talking about what we all want to work on, balance is probably one of the biggest things that people say, and this is a great way to get started on that. Okay. Now we're going to talk about a little more strengthening. We have right at the counter, we call it hip abduction. It's essentially side kicks. So you're standing at the counter and you're kicking your leg out to the side. This one you would want to do on both sides. To make that harder, you maybe could get some ankle weights. Start with a very low weight or even an exercise band around your ankles, okay? And then the last one here is a kick, just like it sounds. You're kicking your leg straight out. Make that harder, adding a little bit of weight or a resistance band. Now this one might seem kind of like a silly one. Well, I'm just kicking my leg, but this is essentially working the top of your thigh, your quadriceps muscle. You need that muscle to be nice and strong. So if you do walk and catch your toe and start to fall, your leg is strong enough to whip itself out and land on the ground so you can catch yourself and not fall down. So that's a really nice one to do, and it's really easy to do in sitting. So give that one a try. The last one is mainly working on our lower leg strength, our calves and the front of our lower legs, heel raises up and down on our tippy toes, and toe raises up and down off our heels. Our calf muscles are some big muscles that help propel us forward with walking, so they're an important muscle to stay strong. It also really helps those ankles stay nice and mobile, which they can get stiff. Now, if standing up, you try this and you just cannot get your heels off the ground, don't fret. Try it sitting down first and just sit and do up and down with your toes. Go ahead and try that now. If you're sitting, you can just see how you're putting your feet up and down. You're raising those heels. And then if that starts to get easy, you just lean and put your body weight through your own thighs and try pushing your body weight up, and then try it in standing and see if you can do it. Obviously, with both of these, you want to hold on as well, just for that extra balance support. So hopefully those few exercises can get you started while you're sitting at home, and try to get you active and moving because I know a lot of us want to get out and get back into some of our exercise classes, and I know that's a hard thing to do right now. So give these things a try if you can't access some of those things. See how you do, have a little fun with it. Ask your companion or caregiver or spouse to join in. It's good to get moving. It's going to make you feel better, and it'll make you feel really accomplished at the end. So with that, that is my soon-to-be husband. I'm getting married in about a month, and my dog, Lester. So I'll open it up to any questions if anybody has any questions for me. Hey, Jeremy.
Hey, Emily, how you doing?
I'm great, thanks.
Good. There was a couple questions that came up during the presentation I'll start with, and I'm sure more will come in as we go.
Okay.
One of the first questions somebody asked was, is there a metronome app you have used in the clinic that you really like and would recommend they look up?
That's a great question. We all learned I am not an IT person right at the beginning, right? I'm going to say no, you guys. When I search in the Play Store, I have a Verizon phone, an Android phone. When I go on in the Play Store, I search for apps. I pick Metronome. I pick the one that's free. So see what you can find. You can always take them off your phone. They all really probably work the same, but play around with them a little bit and see what you like better. Make sure it's just easy for you to use, and that you can get it started, like if you're going out walking. So. Sorry, I don't have a better answer to that one.
It's an honest answer. I think that's all we can ask for, right?
Yeah.
So you mentioned when you were doing some of the exercises, a lot of the exercises you had a sitting option versus and a standing. Mm-hmm. One of the people asked, what if I can't sit to stand? You know, you talked about doing that sit to stand exercise. Are there things they can do sitting that maybe start strengthening some of those muscles that sit in the stand can happen in the future?
Yeah. So I guess one clarification answer would be nice is if they can stand using handrails. So I set up a chair actually behind me. So I'm going to show you. Unfortunately, my chair does not have armrests. Okay. So if you have armrests, you're going to want to use those armrests. But if not, I'll show you. I don't know if people can see me that well. But mainly what you want to do is practice. The first thing would be just to make sure you can move your butt to the edge of the chair. Right there would be a great exercise to start with, okay? And if you can do that, then you start just practice leaning forward and doing kind of a rock, just like this, okay? I have my hands right on the edge of my chair, so I'm just rocking. What you're doing with that is trying to get used to that forward weight shift, which you need to unweight your butt to be able to get up. It's impossible to stand up with your butt still in the chair, right, guys? So you have to unweight your body forward to allow that weight to come off your butt so you can stand up. So if you can't get up using handrails, I keep saying handrails, starting with armrests, first practice scooting back and forth in your chair, and then try doing that rock and just getting that forward rock back and forth. Then when you feel a little bit ready, what I've done in my classes before is we just practice rocking and we literally count 1, 2, back and forth. And when we say, okay, when we get to 10, we're going to try to stand, and boom, we try to stand, and guess what? Most people do. So give it a shot.
Perfect. And it looks like the individual asked that question just added that she may be bedridden at this time. So some of those activities, I think maybe probably having a in-home referral.
Right. Yeah. But if you're bedridden, so I was asked, say, hey, give this a try. Then try to get your knees up. So you're sitting kind of with your knees bent in bed, and just practice rocking side to side and getting some motion through your pelvis. So your pelvis can get used to that motion and feeling how that feels like. And then you could even try just doing a little bit of a butt lift in the bed to try to start getting stronger in your buttock area and in your core. And then hopefully down the road, you'll be able to work on that sit to stand from the edge of the bed even.
Much appreciated. One of the questions I always ask whenever we do a fall presentation, how do you define a fall? And I'll give you the caveat, Emily, is whenever I go to a support group, I'll hear a guy go, oh, I didn't fall. I mean, I stumbled and fell. I landed in the chair. Or I caught myself. And, they view a fall as if I'm not laying perpendicular on the ground, I didn't fall. Right. How would you define a fall?
Yeah. So that's why I was saying at the beginning, kind of asking everybody like, hey, have you fallen? Like, have you almost fallen? And then I define that fall. So a fall really is an unplanned or unexpected contact, not just with the floor, with a piece of furniture. I hear a lot of people, or sometimes I walk in a clinic with people, or walk back to our gym area, and people kind of do a little elbow bump with the wall. That's kind of considered a near fall, because what if that wall wasn't there, or that piece of furniture wasn't there? Where would you have landed? Probably on your butt. And you probably say you had a fall then, right? So that's kind of, I mean, by a therapist definition, and I'm a therapist, that's what we would say was a fall. So in your example, Jeremy, I would have said, hey, buddy, guess what? That's a fall.
Absolutely. And I appreciate it. It sounds better coming from a therapist than me trying to tell that.
Okay, yeah.
One of the other questions that have come up is, any recommendations to improve posture? We know the Parkinson's patient starts to get that leaning posture once in a while. What recommendations do you have to improve posture?
Yeah, that's a very, very common question. I would say, so the LSVT BIG program that I talked about on one slide, they do a lot of exercises in that program that have a postural component. But when I think about posture, I mean, it is literally something that is every movement and day of our lives, including people that don't have Parkinson's, right? It's always trying to think about lifting your chest, right? Lifting your sternum, okay, versus pulling up your head, because then we end up with that forward neck position. So trying to kind of roll those shoulders back towards your back pocket and lift towards your chest. So for postural issues, just orthopedically, based, a lot of times I'll tell people, hey, when you're standing, or if you feel like you're hunched over, start doing some shoulder blade squeezes. We can do that without any exercise bands or anything. And all I'm doing is just bringing my shoulders towards each other, okay, or my elbows, I guess you can say. The other great thing is rolling these shoulders up towards your ears and roll them back and down, okay, not forward. We're already forward enough. Up, back, and down, up, back, and down. And that will feel great. Jeremy, you should give it a try. See how it feels.
I just did it. It actually did feel very good.
Did you? Doesn't it feel nice? Especially if you're stressed or you're sitting forward a lot. Yeah. So rolling those shoulders, doing some shoulder blade squeezes, and just trying to always lift that chest when you're walking.
I just think that shoulder roll is going to be good for when I'm sitting at the table at home from my home office trying to do work.
Yeah.
So I think that's great.
Get them in when you're at stoplights.
Absolutely. Absolutely. I really appreciate you taking the time, Emily. Those were the questions people had. I appreciate you plugging. Mary Wood from our office has been doing a great job with the exercise programs online. And I know Carolyn put a link out in the chat for people. So if you want to learn about those programs and take part in them, please do. I'm sure you as a therapist, and we have seen a lot of people with Parkinson's who, because of COVID, they're not getting out, they're not active, they're not able to go to their regular classes. And we've heard some really great stories of people doing these exercises. They're fewer falls, their mobility is getting better. Then you hit it on at the end. A lot of the spouses and or care partners are also doing the exercises. And they're saying that, I've lost a couple pounds. I feel better. So I think all that is good stuff. So, well, thank you so much for your time. I'm going to transition to our conclusion here. Off stage left,